Thanks for coming back. Mark Manhart at calciumtherapy.com. Say, we got some questions that I thought we should talk about. And one was from Madison, Wisconsin. Well, I just saw a patient from Madison, Wisconsin, and he had a bite problem. You know, a bite problem? And it is really complicated, but we're going to get it. We're going to solve it. We've got to. It's called an open bite. You know, the only teeth biting for him are the back teeth, and only a couple of those. Anyway, about this question that came in from somebody in Madison. What about prevention? What's going on in dentistry with the prevention? Well, you know, fluoridation, that has been a preventive protocol to use. You have to be very careful. There's a lot of rumor around that it's bad, but no, it's really good. You just can't overdo anything. Well, in doing all of this work with the calcium therapy, we deal with the bite, we deal with the gums, the bone, the teeth, and the infection in the bone, infection in the teeth. We've come to a conclusion that dental work per se, whatever that means, dental work like fillings, crowns, bridges, dentures, surgery, treating those things are symptoms. Now just hang on to that a minute. We are doing way too much of symptoms, treating symptoms. We want to get under those and see causes. Because when we talk about this infection up here of the diastemic infection between the upper front teeth, we've talked a lot about that times. We have it all in our website, and it's really good information. There we're talking about causes, because taking out teeth prevents nothing, honestly. Well, you're not in pain anymore, okay. But does it, filling teeth, decay, is a symptom. Calculus on the teeth is a symptom. We've figured this out so well that if we take a panoramic x-ray of somebody, they send us things to tell us what's going on, and you see every tooth, almost every tooth's got something, filling, crown, implant, root canal, everything. When we see that, what we say is, these are the symptoms of the problem, and doing more dental work like that prevents nothing. Hang on. What really works is when we approach this, we know there is something going on here, because this is a good person, a good patient. They have good diet. They live here in the United States, and they have all this dental work, and they need more dental work. That does not make sense. So we look at this and say, these are the symptoms. Let's look underneath and try to find the cause of it. And when you start looking underneath, you get the causes, you treat the causes, like that infection, or it could be the bite. It could be something that the patient is doing that they don't even know is doing any harm. And so the calcium therapy, to me, has become the single most preventive thing in dentistry, because when we see a patient, we save virtually all of the dental work, all of the present dental work or present teeth. We're not redoing anything, and we're saving them and making them work better under better conditions. A better environment in your mouth is going to make a heck of a lot of difference. Not just in your teeth, I mean your whole digestive system is affected by what you're doing in the mouth. And so we look at it as, let's stop working on doing more dentistry, which is treating the symptoms, and start working on this causes of this. And when you do this, I'll tell you, patients, they change completely. They become normal. They're not terrorized by dentistry. That is something that has happened so much, I just hate to even talk about it. Why are we afraid of our dentists? Why don't we trust our dentists? When I was a kid as a dentist, we were the most trustworthy dentist, trustworthy profession of any profession. And I want that back. And if we don't get away from this treating the symptoms, we're stuck. And we're stuck with people that are miserable. Thanks for coming to calciumtherapy.com.